Hello students, I am here to explain about a most important branch of external carotid artery, that is the maxillary artery. Maxillary artery is the larger terminal branch of external carotid artery which is given off at the neck of mandible. So here is the lateral view of the skull showing the arteries as well. So this is the external carotid artery. We can see external carotid artery terminally dividing into maxillary artery . And the other branch which is vertical continuation of it is superficial temporal artery. So maxillary artery is the terminal branch of external carotid artery. We can see it is given off at the neck of mandible. And it has a wide territory of distribution and it supplies external and the middle ears and the auditory tube. So we can see it is quite near to the external acoustic meatus, so it supplies external ear, middle ears and the auditory tube, and it supplies the dura mater, upper and lower jaws with their teeth, and it supplies muscles of temporal and infratemporal regions. It also supplies nose and paranasal air sinuses, palate and root of pharynx. So there is a wide distribution of maxillary artery. Course and relations. For descriptive purposes, maxillary artery is divided into three parts. The first part is the mandibular part, second part is pterygoid part, and the third part is pterygopalatine part. So the lateral pterygoid is considered as key muscle of infratemporal region because it divides the maxillary artery into three parts. So the first part of maxillary artery, we can see it is horizontally to forwards between the neck of the mandible and sphenomandibular ligament. So neck of the mandible is cut and removed to expose it, and we can see the sphenomandibular ligament as well. And it courses just below the auriculotemporal nerve, then along the lower border of lateral pterygoid muscle. The second part is called pterygoid part. It runs forwards superficial to the lower head of lateral pterygoid. So lateral pterygoid has got two heads, upper and lower head. So the part which is superficial to the lower head of lateral pterygoid is the second part. So second part is otherwise called pterygoid part. The third part is the pterygopalatine part. So pterygopalatine part passes between the two heads of lateral pterygoid and then through the pterygomaxillary fissure to enter the pterygopalatine fossa. So we cannot see pterygopalatine fossa externally because it is quite deeper, but we can trace the artery how it runs in the pterygopalatine fossa. So after entering into the pterygomaxillary fissure, it is considered as third part, which is the pterygopalatine part. Let's see the branches of maxillary artery. So we shall start with the branches from first part of maxillary artery. To remember the branches from the first part of maxillary artery, we can make an abbreviation called 𝐻𝐵𝐼. 𝐻𝐵𝐼 means peace in Malaysian language. So D stands for auricular artery, deep auricular artery. So the first part of maxillary artery is just below the auriculotemporal nerve. We can see here this is auriculotemporal nerve. So till here to here is the first part. Let us name its branches. Deep auricular. Next to deep auricular, A stands for anterior tympanic artery. And next to the anterior tympanic artery is the middle meningeal artery. We can see middle meningeal artery which is wrapped by the two slips of auriculotemporal nerve. And we can appreciate the mandibular nerve exiting out through foramen ovale, and middle meningeal artery is just posterior to the trunk of mandibular nerve, where it is entering inside the cranial cavity through foramen spinosum or nervus spinosus to supply most of the meninges. Accessory meningeal artery. Next is the accessory meningeal, which is along with the mandibular nerve, and it enters the cranial cavity through foramen ovale. Last is the inferior alveolar artery. I stands for inferior alveolar artery, which is downward directed. Which supplies mandible, lower jaw, forming dental arteries to supply all the teeth and its sockets. So, these are the branches from the first part of maxillary artery. I will explain again. The deep auricular artery supplies the external acoustic meatus, tympanic membrane and temporomandibular joint. Anterior tympanic branch supplies the middle ear, including the medial surface of tympanic membrane. Middle meningeal artery lies between the lateral pterygoid and sphenomandibular ligament, then between the two heads of sphenomandibular ligament, and between the two roots of auriculotemporal nerve. We have seen here the two roots of auriculotemporal nerve, which are converging again to form auriculotemporal nerve, and it enters the skull through foramen spinosum to reach middle cranial fossa. So, in the cranial cavity, the middle meningeal artery divides into frontal branches which course towards the pterion and small parietal branches. So, here we can see the terminal branches of middle meningeal artery. And then towards smaller parietal branch. So, frontal one is little larger than the parietal branch, and the middle meningeal artery terminates at the pterion, where these two branches form there. And the accessory meningeal artery. Next is the accessory meningeal artery. It also meant to supply the meninges. It enters the cranial cavity through foramen ovale. So, we can see an artery along with the mandibular nerve. Entering the foramen ovale to enter inside the skull. Apart from the meninges, it supplies the structures in the infratemporal fossa. An inferior alveolar artery runs downwards and forwards medially to the ramus of the mandible to reach the mandibular foramen. So, it runs downwards. In this image, we can appreciate inferior alveolar artery. We can see it is coursing downwards, forwards into the body of the mandible. It enters into the body of the mandible through the mandibular canal, and in which it runs further downwards, and before entering the mandibular canal, this inferior alveolar artery gives off a lingual branch to the tongue. So, here is the inferior alveolar artery. Before entering the mandibular canal, it gives off a branch to the tongue, which is called as the lingual artery. And also it gives rise to artery to 𝐒𝐫𝐢𝐻𝐼oid. 𝐒𝐫𝐢𝐻𝐼oid branch that descends in the 𝐒𝐫𝐢𝐻𝐼oid groove on the medial aspect of the mandible and runs forwards above the 𝐒𝐫𝐢𝐻𝐼oid muscle. Within the mandibular canal, the artery gives off branches to the mandible and to the roots of each tooth attached to the bone. It also gives off a mental branch that passes through the mental foramen to supply the chin. So, terminally it exits through the mental foramen as mental artery. So, that is the termination of inferior alveolar artery. Now, let us understand the branches of second part of maxillary artery. It is easy to remember the second part of maxillary artery branches because most of these branches are muscular branches except one. So, the mesenteric artery. So, from the second branch we see an artery to the masseter. Mesenteric artery supplies the masseter. Then two deep temporal arteries. So, we can see two arteries running upwards called as deep temporal. And also to the pterygoid muscles we can see the branches to lateral and medial pterygoid as well. So, one mesenteric artery, two deep temporal arteries which are anterior and posterior. Deep temporal arteries ascend on the lateral aspect of the skull deep to temporalis muscle, and the third is the pterygoid artery which supplies the pterygoid muscles, and there is also one more branch which is called buccal artery which supplies the skin of cheek. Now, let us see the branches of third part of maxillary artery. So, remember the branches from the third part of maxillary artery, you can make an abbreviation as PICPAS. So, P stands for posterior superior alveolar artery. So, as there is no space I am writing short forms, posterior superior alveolar artery. The next branch is the infraorbital artery. Infraorbital artery is the terminal continuation of maxillary artery. So, infraorbital artery we can see it exits through the infraorbital foramen over the face. And next is the greater palatine artery. We can appreciate greater palatine artery in this image. And next one is the pharyngeal artery which supplies the pharynx. This one is the posterior superior alveolar artery. Pharyngeal artery to the pharynx, then artery to the pterygoid canal. The next artery is the artery to the pterygoid canal which enters the anterior part of middle ear. So, here is the artery to pterygoid canal. And next is the Sphenopalatine which is the terminal branch. Sphenopalatine artery supplies the nasal septum and lateral wall of nose. So, recalling the branches of the third part, posterior superior alveolar artery arises just before the maxillary artery enters the pterygomaxillary fissure. So, just before we can see posterior superior alveolar artery emerging out of maxillary artery. It descends on the posterior surface of maxilla and gives branches that enter the canals in the bone to supply the molar and premolar teeth and also to the maxillary air sinus. Inferior orbital artery also arises just before the maxillary artery enters into pterygomaxillary fissure. It enters the orbit through inferior orbital fissure. We can see it enters through the orbit through inferior orbital fissure. It then runs forwards in relation to the floor of the orbit, first in the orbital groove and then in the orbital canal to emerge on the face through infraorbital foramen. So, we can see here this is infraorbital foramen through which the inferior orbital artery is exiting out, and it gives off some orbital branches for structures in the orbit, and it also gives rise to middle superior alveolar branch for premolar teeth and anterior superior alveolar branch that apertures into the maxilla to reach incisors and canine teeth and attach to the bone. So, we can see it gives rise to, this is anterior superior alveolar artery, and here is the middle superior alveolar artery. So, it gives rise to middle superior alveolar branch and anterior superior alveolar branch. So, completely upper jaw is supplied by 3. So, 3 arteries. Posterior superior alveolar artery is a direct branch of maxillary artery, we know that. Anterior superior alveolar and middle superior alveolar arteries, they are the branches of infraorbital artery. And the remaining branches of the third part arise within the pterygopalatine fossa. So, greater palatine artery which runs downwards towards the greater palatine canal and emerge into the posterolateral foramen. So, in this image we can see the greater palatine artery which is entering into the greater palatine foramen to supply the palate and also to the nasal septum and lateral wall of nose. It then runs forwards near the lateral margin of the palate to reach incisive canal near the midline. So, we can see this is the incisive canal which is located in the midline, through which some terminal branches enter the nasal cavity. Branches of the artery supply the palate and gums. So, branches of this greater palatine artery, it supplies the palate and gums, and while still within the greater palatine canal, it gives off lesser palatine arteries that emerge onto the palate through palatine foramina and run backwards onto the soft palate and tonsil. Next, regarding the pharyngeal branch runs backwards through the canal related to inferior aspect of body of the sphenoid. So, we can see the pharyngeal artery and it supplies a part of nasopharynx. Pharyngeal artery supplies part of nasopharynx, supplies the auditory tube and tympanic cavity. Next, artery to the pterygoid canal. Artery to the pterygoid canal, it of the same name because it helps to supply the pharynx, the auditory tube and tympanic cavity, and it runs in a canal called as artery to pterygoid canal. Next, about the sphenopalatine artery. Sphenopalatine artery passes medially through the sphenopalatine foramen to enter the cavity of nose. So, it enters the cavity of nose, sphenopalatine artery, and it gives off posterolateral nasal branches to the lateral wall of nose and to the paranasal air sinuses, posteromedial branches to the nasal septum. So, medial branches to the nasal septum, posterolateral branches to the lateral wall of nose. Sphenopalatine artery is the artery of Epistaxis because it contributes mainly in the Kisselbach plexus, which is located in the antero-inferior part of nasal septum. So, this completes the maxillary artery along with its branches and its distribution. Thank you.